Great. Thank you so much for that, Sophia. So welcome to How to Advocate for Yourself to the Dentist. My name is Dr. Mariche. Next slide, please. So we can introduce ourselves. I am a dentist here at Philadelphia FITE. I went to school here in Philadelphia at Penn. I also did my residency training and general practice residency here at Penn, at the VA as well in Philadelphia. And I've kind of been here. I'm originally from California, and I came to Philadelphia and found it as a fun place to be in the Northeast, and I'm here to stay for the foreseeable future. And with us, we also have Sophia, so she'll introduce.
I'm a third-year dental student at Penn Dental Medicine. I started working at FITE last summer as a dental assistant, and now I'm kind of like a part-time scheduler for them. And then this fall, I'll start my community health honors through the dental school at FITE Family Dentistry.
So today what we'll go through introducing us as ourselves, where we work, kind of what our roles are at Philadelphia FITE and in the greater Philadelphia community. And then we'll also talk about advocating, right? Like how we want you all and how you all can be supportive of people that you need to be advocating for, also how to teach yourselves to advocate, at the dentist, because this is something that is important for everybody, not just the patients that come to Philadelphia FITE that we treat on a regular basis, right? And then we'll go through and talk about how the context of HIV and as it relates to dentistry in itself and orally, and how that also can have what kind of like impact and implications that can have for your overall general health. And then at the very end, we'll also talk about like the growth in the dental field, right? Like what we've done, where we've come, and what we can do and what we can do to improve so that we can improve the health outcomes of the patients that we see as an organization. Next slide, please. So we have here at Philadelphia FITE, right, we have, obviously there's medical and then there's dental. Specifically in the dental department, we'll have dentists, we have dental hygienists as well, and then we have our assistants. And our assistants can be someone's called an expanded function dental assistant, and is essentially like an assistant with more training and an additional license to be able to do more advanced procedures in dentistry. And then all of that comes together to essentially say, this is how we at FITE treat our patients and are able to offer the best care that possible on a day-to-day basis. Next slide, please. So again, right, so what I would love at the end of this webinar, the best thing here would be that you understand like what the big things to look for in terms of orally, specifically what types of things come up most often in patients that have HIV and how they deal with it, and how they can better advocate for themselves in order to keep themselves as healthy as possible. And then also it'd be really important to understand like, what providers are best equipped to treat patients, right? Especially patients that have HIV, because there is a lot of stigma there, and it's important for patients to go to places where they feel accepted and comfortable and don't have to feel worried or, be like, what are they going to think of me, blah, blah, or things like that. Because unfortunately there are many papers out there that show that really impacts the healthcare of patients, and it creates a barrier in itself. Next slide, please. Okay, and this is then showing exactly what I talked about. So we want to prepare, right, how we can promote oral health and what are ways that we can encourage to reduce the barriers.
All right, so the next section, we're going to talk about what we can actually do to advocate for ourselves. So I think the great place to start is kind of why advocating for yourself is important. Number one, it can help reduce anxiety. A lot of dental fear stems from feeling like you don't have control. You're sitting in the dental chair, people might be talking in terms you're not familiar with, and you're just kind of there to get treatment. But if you're able to kind of speak up for your needs or ask more questions to kind of understand what's happening, that could really help reduce your anxiety. Additionally, advocating for yourself can help improve communication. You'll be able to feel more heard and more supported, and you can kind of take a more active step in how to best care for your dental health. Another reason it's important is it can lead to more positive relationships. It allows it allows for a more honest picture of your health and encourages you to return for treatment. So if you are able to be more honest, like if you're talking with your dentist and they're asking you like, how often do you floss? If you feel more positive towards them, you're more likely to be honest. And then lastly, it can lead to a better understanding. So if you're able to be on the same page with your provider, you're more likely to get the needed treatments and the treatments that you want. So your goals are more likely to be accomplished. That kind of leads us to our next part here about what is mutual participation. So there's a variety of different patient and doctor relationships. So a kind of an older version is a paternal relationship where the dentist kind of just tells you like, okay, you're going to need this, this, and this. And the patient is just kind of supposed to accept that and maybe not ask as many questions. But that's kind of an older view. And today we strive more for something kind of along the lines of mutual participation. So where the patient's more informed, takes a more active role. And like, for example, the dentists at FITE are trained in this. They often give seminars at like Penn Dental about how to have this more informative relationship with patients. So a way that this could work is, so obviously the patient is an expert in their goals and their values and their life experiences, while the doctor is more of an expert in the practice of dentistry and kind of can make sure that the patient is able to achieve those goals. They can provide the treatment. Another role of the doctor is to kind of help the patient identify their goals. Sometimes people come in and they're not sure. So that's why this conversation is so important, and communication in general, just so that everyone's on the same page and together they can work together to get a more positive outcome. So another important factor in advocating for yourself is kind of understanding your rights. A lot of these are more talked about, like things like right to privacy or right to confidentiality. Those are pretty common when we talk about like medical care or dental care. But there are some other ones here that I feel like aren't always emphasized. So right to obtain a second opinion. If you aren't really understanding something or don't really have the explanations you're looking for, it's always okay to go ask another provider and see if that is what's best. You have a right to give your informed consent, so signing off on treatments. You have a right to obtain reasonable care and treatment, and a right to all of your medical records. You have a right to expect continuity of care, and a right to know whether you're a part of any trial or clinical research. And then now I'm going to dive into a couple more just in more detail. So you have a right to healthcare that meets your needs. This is kind of similar to the right to continuity of care. Like if you're going to some place and then all of a sudden you call them and they're not scheduling you or something, like you do have a right to actual care. If they aren't able to meet the needs that you need, they can always refer you, but you do have a right to actually getting treatment that you need. Another one that's important, and I really like this one, but a right to self-esteem. You have inherent worth and inherent abilities that can help you. Like I was saying, you know what your goals are, you know your life experiences, so you can really take an active role in your care. And I think a lot of people are afraid of going to the dentist because they're afraid of feeling, shame or things like that. But you have a right to be feeling positively towards yourself throughout the entire appointment. And then lastly, a right to respect. So that goes both ways. Through the patient and the provider both deserve respect, but I think remembering that is really important. So what are some more tangible things that can facilitate better communication? So there are some things that you can try to avoid doing, and then some things that you can try and do. So some things not to do is it's better to ask your questions sooner rather than later. So don't hold your questions till the last minute. Things always do come up, so it's fine if you have a question, but maybe think about it before you go to your appointment about things that, you didn't really understand last time, instead of, mid-procedure being like, oh, I should have asked this earlier. It's always okay to ask things, but sooner rather than later is better. And then don't feel stuck with one provider. This is kind of like what I mentioned before. If you do have a right to a second opinion, and then if you're really not feeling positively towards your provider, you can always look for another one. And then don't believe everything you see online. It's really easy to Google different things and Google symptoms, and you can always kind of find the answer that you're looking for, but whether or not that's true or or applicable to your specific situation, it really can can vary. So asking your provider, like, hey, I saw this on the internet, or hey, I saw this like TikTok trend. It's always better to kind of ask your provider what they think. And then this one's also really important, but don't pretend to understand something you don't. So if your provider's explaining something and then they're like, oh, did you get all that? Did you understand? Even if you didn't, like, don't say that you did. It's always important to be honest. And though it might take some more time, a lot of times there's time built into the appointment for that. So like at FIGHT, our appointments at the beginning are around like 40 minutes. And so there's really built-in time for you to ask questions and really to get that understanding. And then some things you can try to do, this is kind of along the same lines, be honest, but also communicate. If you're not comfortable with something or you have a question, like speak up for yourself. It's always helpful for everyone working with you as well. Taking notes is helpful before the appointment, during the appointment, or you can always think afterwards like, oh, hey, I didn't actually get that. Like, and then for the next appointment, you could bring in those notes and reflect on that and speak with your provider. And then you can always ask for explanations. So if you didn't really understand something, you could ask, hey, can you repeat that? I didn't really grasp that. Or you can even ask to see for yourself. A lot of times there's patient mirrors around and you can ask like, oh, what is this thing on my tongue that you mentioned? Like you can ask to see it for yourself. And then I think this is also a great example. If you are told, you need a root canal or something, but you're like, that tooth doesn't even hurt. Like, what are you looking at? And they could show you an x-ray or something and kind of explain what they're seeing and why they recommend the treatment that they do. So some different questions you could try. Are there any alternative options, just to kind of get a picture of, do you have any options? And if you do, like, why don't they work for you? Things like that. You could also ask, could you please clarify what you're going to do today? You might have a lot going on and it's easy to forget, so checking in is a good place to start. Could you try using different words to explain this? If the terminology, the words they're using is just too different from what you are familiar with, I'm sure they can come up with a way to explain something. What might have caused this condition? Understanding the why is really important. So questions like this can be useful. What are the long-term and short-term effects? How many appointments will this take? It's always a good idea to kind of know what you're committing to. So knowing how many appointments can help you frame your mindset. How long will this filling or a denture or whatever treatment you're getting last? I think it's important to kind of know what you're working with and how you could make it last longer, things like that. It's a good way to open a conversation about that.
So now that we've kind of touched a little bit of the surface on how to advocate yourself and what that kind of looks like and examples of that, I think it's also really important to contextualize this, right? So advocating for yourself is one thing, right? But why is it so important here, specifically for patients that are living with HIV? Next slide, please. So as we said earlier, right, the goal here is to empower yourself. You want to make informed decisions about your dental care, right? But conversely, you also want to make sure that you're with someone who is also informed about what they need to do to keep you healthy. Next slide, please. So the big thing here, and the reason why this is so important, is because essentially because of the stigma that there is and how HIV came about, way back when, like a few decades ago. Even though there's been a lot of advancements in medicine and to keep people healthy and living long lives and not HIV not being a death sentence anymore, the problem is that the stigma still has not really changed. And it's a problem because it affects the way that patients go about their care, right? They're nervous, they don't seek the treatment that they need, and they avoid it because of the shame or the guilt, in addition to all the shame that there already is with a lot of people behind oral health when they have cavities in several teeth and they have pain here and pain there. Oftentimes, even when I'm treating patients, they'll be like, oh, my mouth is so embarrassing. I've been putting this off and, I finally had to come in because I couldn't take the pain anymore. And then I have to remind, I will never judge. We don't judge here. We're here to help you. We're here to make things better. And, I try to empower and essentially encourage and be like, come back, so that, there's a lot of other things that we can still do. And, usually when patients come in, the road is usually not too far gone. Sometimes it is, but most often it's not. So that's just, you know, an explanation there to say that the problem of there being this medical mistrust does affect patient care. And you know, if we're aware of that, then we can combat that and find ways and be like, oh, you know, why don't I trust this person? Or what providers do I feel comfortable with? Or what providers can I trust? And generally those providers you'll find in organizations that are attached to a medical component where they treat patients that live with HIV, and that's part of their mission statement. Like FIGHT is one of them, right? The other organization in Philadelphia is Mazzoni Center. They don't have dental attached to it, but they have providers there that are informed about that and are culturally sensitive to that. Next slide, please. So, like I was saying, right? So if we are aware of medical mistrust, then we're like, okay, then I know what I can do to advocate for myself. And I know that I can take that power back because I understand the situation and what's going on, right? And so there was this nice little article that essentially talked about, it broke it down, and it basically was giving all sorts of information on you know, the impact that medical mistrust has on patients, and specifically in patients that live with HIV, and how that disproportionately affects people of color. And I'll share some of those statistics in just a second, but first I think it would be important to kind of go through this article. So next slide, please. So here, right, so what can we do? So if you understand what's uncomfortable, and I'm looking at the first bullet point here, you will know, right, you can figure it out. You can kind of do some self-reflection and be like, why is this way, right? And you know, secondly, if you feel that other people are uncomfortable, then, you know, one, take the power back, but two, maybe that's not the best provider to treat you, right? Just because someone says that they're going to treat you and doesn't discriminate doesn't mean that they don't have implicit bias, because there is pressure from society for providers to, you know, not discriminate and do all sorts of things. Unfortunately, just because we're not supposed to do it doesn't mean that that's not something that's systemically built into how this country was, you know, created. And so just being aware of that, like, systemic discrimination can help combat that, getting better care, right? And not being unaware and being like, oh, well, they said that they were okay to do it, so let's just go. And then, like Sophia was saying earlier, right, you want to think through your questions. You want to understand, like, what is it that you are, you know, really want to know, and how can you better help yourself, and what exactly is that you need to do, right? Like, if you want to get another appointment, but they're not returning your calls, why are they not returning your calls, right? Is it that they're really busy, or is it that because, you know, they're just hoping that you, like, disappear or go away? You know, and this happens with patients all the time. It happens with patients that don't have the ability to pay. It happens with patients that have a lot of medical conditions, right? And just because a patient is more medically complex doesn't mean that they deserve less than ideal care. Everybody needs the care, especially the patients that are more medically complex, because more things can happen. Educating yourself, right? Policies around HIV care, what's fair, what's not, what they're allowed to do, what they're not allowed to do, right? Unfortunately, we live in Philadelphia where it's a lot more progressive, and the laws don't allow for things like blatant discrimination or such ones that don't exist like that in the South, or like even what's going on with Florida right now, and the whole thing with being able to refuse treatment for someone just because of their LGBT identity. Okay, next slide, please. So I kind of just want to drive the point here on, you know, even though a lot of people are scared to go to the dentist, or there's a lot of anxiety out there, and that prevents people from getting it, it doesn't take away the importance of having it, right? And the fact of the matter is that the sooner you get into that door in that dental chair, the better that your health outcomes will be long term, right? Because in dentistry, mostly everything is preventable, right? Cavities, oral health disease, right? Like cavities is one of the most, if not the most, preventable disease, most common preventable disease in the world, which is a problem because if it's preventable, why are we not preventing it? And in the United States, we've done a lot of work to get that to be at a much better level, right? But we still have a lot of work left to do. The fact that we still have a lot of cavities in children is a problem, right? So it's really important, to get there sooner than later. And then when you do get in, come back, because prevention is going to be key, right? Besides intervention, which is where I'm talking like, okay, now we have to take that tooth out. Now we have to do, the root canal, or now we have to do the filling. It's going to be a huge filling. And that just every time we go and we intervene to make the mouth healthy again, we really cut down the lifespan of that tooth. Next slide, please. So here are some of the statistics that from that article that I was talking about. So here it's 15% of people who report postponing brain medical care is because of discrimination, right? So they feel that they don't want to even deal with it because of what they're going to face, and they don't want to feel that way, right? Because it's not a great feeling. It's an awful feeling. And then over here, it was also talking about how new HIV infections are disproportionately affecting people of color, and that's concerning because people of color already have a lot of other barriers against them, right? Whether that could be like where they live, whether it could be if they're in a rural or a city, right? You have less resources in rural America than you do in a city, right? But even in a city, if there's a lot of people, then those resources are going to be a lot less per person. And so we want to make sure that, we're aware of that and we are supporting people that need this dental care the most. Next slide, please. Okay, so now we're going to get into the more kind of sciencey part of this. And I kind of wanted to take a moment here because a lot of what I'm about to talk about is not just specific to patients with HIV, it's just they're higher risk for it. And so because they're higher risk, it would be more important to kind of just break down what these big words mean and explain it more in simpler terms. So obviously they'll ask about medications, and why that is important is because the more medications that patients take, the higher the risk for patients to have something like dry mouth. Saliva is really important in helping prevent cavities and helping keep the mouth healthy, right? As soon as our mouth becomes acidic, so like when we eat those sugary drinks, those sports drinks, sodas, when we're snacking, every time we're doing that, the bacteria in our mouth are taking that food, converting it, using those carbs as energy, and then the byproduct, after they use the energy, they produce acid. And that acid basically pulls all of the really strong parts of the tooth out. So when they say those minerals and demineralization, it's pulling minerals out of your teeth into the environment to kind of help neutralize the acid. And every time you pull minerals out, you make the tooth weaker, and then that's how you start to get those holes in your teeth, and then it goes all downhill from there. So medications is important, realizing that can cause dry mouth. CD4 count is obviously going to be important here because that's going to be directly tied to how well your immune part of your immune system functions. So the lower the count, the more severe that you're going to have certain conditions, right? Like if you're going to have swollen gums like gingivitis or bone loss like periodontitis, you're going to have more severe manifestation of that. And other health conditions and habits, right? What are you doing as a patient, that can either help protect you from cavities and other oral diseases, or what habits are you partaking in that make that more likely to happen, right? So are we snacking a lot? Are you using a toothpaste with fluoride in it? That's going to help you, right? Going to the dentist regularly, that's going to help you. Snacking a lot, that's going to count against you. Brushing your teeth with something that with a toothbrush that's hard, that's going to also count against you because it's going to wear away at the surface of the tooth much faster than a soft toothbrush. And so those habits essentially is going to help categorize, is this patient high risk for cavities and gum disease? Is this patient medium risk or low risk, right? And the higher the risk, the more aggressive that we want to be with our patients. And when I say aggressive, I don't mean like doing aggressive treatments. I mean that if I see a little baby cavity, I'm going to be more inclined to treat it on someone who's high risk. I have someone who doesn't come to the dentist very often and I see little cavities, I'm going to be more inclined to treat it because the likelihood of them coming back is or I guess the likelihood of them not coming back is a lot higher. And what I don't want is I don't want them to be in my chair a year later and now we have to pull the tooth because we wanted to wait and watch the cavity. Conversely, if a patient has a low risk, right, they come all the time, and I'm like, okay, I've seen you, every 6 months for the last 5 years, and I see a new cavity forming, I'm gonna be like, okay, we'll watch it, we'll get another X-ray. If I see something change, then we'll take care of it. Next slide, please. Okay, so what might be you looking for, right? So when you come into the dentist, what exactly is it that we're gonna look for and tell you, and then we're gonna give you this list. Now, at FITE, we will be a lot more, what's the word? We're not gonna throw big words at you, right? We're gonna keep it simple. We're gonna make sure you understand, and we're really gonna take that time. Unfortunately, the nonprofit sector is very different from private practice dentistry, right? And that is unfortunately most of what dentistry is. So what I want to take this time is to kind of just help educate and teach what these words could mean and how, what these words can mean. So if you run into them, you know exactly what they're talking about. So we're going to see a lot of gum disease, right? Periodontitis, which is basically just inflammation of the supporting structures around the tooth, right? So it's the thing that anchors the tooth in your bone, in the mouth. And when you have inflammation of that, it's chronic inflammation that over time, what ends up happening is the body's immune system works so strong that it works, its purpose is to fight off the bacteria. But what it ends up doing is it ends up killing your bone, because it's the immune system strong, right? When you have an infection, say you get like a fever, it's because your immune system is working really hard to fight things off. The difference here and why we get chronic inflammation, right? Because the way that it works anywhere else in the body, like in your arm, you get a cut, it swells up, right? Just a little tender, and then it heals. That's because the skin regenerates. Our teeth do not regenerate. You're born with the teeth that you have. So when our body tries to mount the same response in when our body tries to mount the same response in our mouth, it ends up just leading to chronic inflammation, right? So a long-term inflammation, and having that long-term inflammation is what ends up causing the bone loss, and that's the biggest reason for why people end up losing their teeth is gum disease, not cavities. And this is a lot more common in patients that are living with HIV, and they don't exactly know why it's doing that, but it has absolutely something to do with how it affects the immune system. And dry mouth is also common, and that could also have that. There have seen dry mouth with certain antiretrovirals, but also is that people with HIV are living longer. So the chances of them getting some other kind of medical condition as they get older, because that is normal for most Americans, is much higher. So then that's just another medication that they have to take. And the more medications you take, the higher chance you have for dry mouth. And that's not good, right? Because then you don't have the saliva, you don't have that protective factor, and you're more at risk for cavities. And then oral lesions, right? So really what we're looking here is, like, if you see on this picture here, you see like this white, and that obviously is not normal, right? These lesions can manifest themselves as red, and oftentimes they're painless. So that's concerning, because if you hurt yourself, it should feel like it should be painful. So if you see something there and you see here how it's like a really sharp line, like it's white and then it's not white, like you can take a pencil and you can circle around it and you see that really that little sharply defined border, generally is not a good sight. So you would want to get that looked at as well. Next slide, please. Okay, so now I'm going to go into the specifics of what I just gave the overview of. So what is periodontal disease? It's inflammation, and I've already explained it, but here we have a visual here. So you can see on the left side, this is what health looks like. You see that nice bone, you see the little stars to show that it's really nice and clean, and then you see the nice little pink gum, right? Now reflect it to the other side. So you kind of see this little brown thing that kind of like bulges out. That's tartar. That's buildup. That's basically fortified plaque. So it's the white stuff that you get around your teeth. And if it's there long enough, it looks like tooth. And sometimes patients are going to be like, oh yeah, I lost a little bit of tooth. And oftentimes it's tartar that just popped off. And that's not good, because that is loaded with millions of bacteria, and your body recognizes it, and then it freaks out, and then it leads to inflammation because it's trying to fight off the disease or the bacteria that are invading, right? And it won't, because like we said, teeth don't regenerate. So it doesn't work the same way that skin does or any other part of the body. And then that inflammation over time, and I'm talking years, I'm not just talking like a week or a month, I'm talking years of not having this addressed or not knowing that it's a problem, can lead to bone loss. And then that's when your teeth start to wiggle and then potentially fall out. And so this process that I just described always starts as gingivitis, right? And then the longer it's there, eventually when you start to lose bone, that's when the diagnosis moves from gingivitis to periodontitis. And there's different levels of periodontitis, right? There's mild, there's moderate, and there's severe. And then there's necrotizing periodontitis, which is basically something that just like it's just really quickly, it goes like from 0 to 100 and it hurts. And that is something that you usually would go to see someone about because it hurts. And next slide. Okay, so what contributes to this, right? So this is now smoking, right? So we went back to those habits. So if you smoke, more likely to get this, right? If you have chronic conditions like diabetes or high blood pressure, that's going to also contribute. If you are stressed, right, that's going to contribute because that affects the way that your body handles things, right? Dry mouth going to contribute because remember, saliva is protective. And then what happens when you get periodontal disease? So we have the consequences here. So like I had explained earlier, right, you can lose your teeth, right? You lose your bone. If you lose bone, it's going to make it harder to replace the teeth, whether you want an implant, whether you want like a partial denture, it's going to affect it. You also, if the periodontal disease is left unchecked, for women, it could also lead to earlier births and not like a preterm low weight birth, right? So premature. And then problems controlling blood sugar in people with diabetes. And this is essentially how diabetes is a chronic inflammatory condition. And so this is why it is linked and tied to periodontal disease. So what are the things that we can do to help combat that, right? Obviously, good oral hygiene. What the heck does that mean? I brush my teeth, and then my dentist tells me that I have all these issues, right? Well, as you get older, right, and you lose bone, you lose, and you get like longer teeth, you have to change the methods, right? As you get older and you lose dexterity, you have to change the ways that you do that. And the only way that you're going to know these things is if you go to the dentist regularly and then they tell you, okay, I like what you're doing here, but this you have to be better, right? And unfortunately, it's not like, it's not like dressing up where you can see if something looks good. It's a lot harder because one, it's in the mouth and you can't see, and two, it's dark in there. So you really need a light. And so the person that's going to help you do that is going to be a dental professional, whether it's a hygienist or a dentist. And then, if you do end up getting periodontal disease, getting cleanings done, which are called deep cleanings, is going to be really important. That's actually the third bullet point here, if we can, thank you. And catching things when they're early, right? So the best case scenario is you come to the dentist, everything's good, you keep coming, and we prevent it. But if you do get it, catching it early is going to be the next best thing. And then, we'll work with you on how to improve your overall health, because the mouth is tied to the body, and the healthier the mouth is, the better that the body is going to be. Like, for example, the way that oral health is directly tied to diabetes. When patients have a better oral health, they end up having better management of the diabetes. Next slide, please. And then dry mouth, right? Saliva is super important. When we get dry mouth, then our tongue starts to stick to each other, not each other, sorry, our cheeks and tongue start to stick to each other, starts to stick on the roof of the mouth. If you've ever, like right now, my mouth is getting kind of dry, I'm gonna need a sip of water very soon, and it's getting hard for me, and I'm like smacking my lips. And thank you. And so this is something that we know that it's a higher risk in patients that are living with HIV, right? Because either it's the medicines that they're taking, right? Or the fact that they could be taking other medicines. It could also just be the way that HIV can affect the dry mouth and how like the body's processes. And then we'll go over consequences here. So like I said earlier, right? The first thing, cavities because of the acid. Increased plaque because saliva helps prevent plaque like build up. And so if it's not there, it kind of goes wild. You end up getting mouth sores. Saliva is very important. It works as a lubricant in your mouth and it keeps your mouth healthy. If your tissues dry out, and then it becomes a lot more friable and you can get sores. Kind of like a really good explanation is like when you put salt on a wound and it hurts because you're drying it out, it's the same thing. Okay, and then prevention, right? So sugarless gum, right, or mints too, that like those other hard candies, coming into the dentist, sipping water more frequently, or having saliva replacements. They also have mouthwashes out there that are meant to help kind of like re-wet the mouth. I always recommend just carrying around a water bottle with you. Okay, and then here for oral lesions, I really just wanted to kind of take a moment to reiterate the white and the red, right? You see the sharply defined borders. These typically do not hurt. You cannot wipe them away. So if you see it, first thing I would say you could try to do is maybe if you have some gauze or like a nice moist washcloth and kind of just see if it rubs off. Don't be aggressive. If it hurts, don't do that. Obviously, if you're unsure, don't do it. Come see a dentist. But these are things that you can do to see. And the last thing here, and really what I really wanted to kind of drive home here from oral lesions, is the oral cancer risk. So it's really important to note that patients that live with HIV, for whatever reason, they are a lot more likely to also have HPV, but not just HPV, but the one that causes cancer. I want to say the number, it doesn't matter, it's number 16, but that is the one that we're really looking for. And so why this is important is because, obviously there are vaccines and whatnot, but we have to have the vaccine before we ever get exposure to the virus. So the younger you get it, the better. But if you don't have it, then you know that there's going to be a higher risk for oral cancer through HPV. So what does that mean? That means that if not for anything, if you're like, I don't have any issues with my mouth, everything feels good, the one reason you should be going is to get your oral cancer screening every 6 months. Your dentist should be looking in, pulling your cheeks out, feeling here, feeling here, feeling here, feeling here, making you turn this way, feeling here, making you turn this way, feeling here, sticking your tongue out left and right, and you do the whole thing and they look in the back of the throat. Because unfortunately, this is a very common cancer and it's often caught way too late to the point where it becomes really harder to control. That eventually leads to death. So not to like end on a morbid note, but super important, even if you feel like everything is fine, you want to look at the oral cancer, and if you're drinking more than the recommended units of alcohol a week, or you're smoking, those are also going to increase your risk. And if you do both, say one increases your risk by 5% and the other one increases by 5% together, it's not going to be 10%, but it's going to be like 15 or 20%, because it's a cumulative effect and they're synergistic. It's not just kind of additive. So it becomes super, 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 super important to come in for oral cancer screenings. And final slide for my section here. So takeaway, there's a higher risk for getting periodontal disease, right? There's higher risk for getting cavities because of dry mouth. So being aware of that, prevention is everything. So getting into a dentist ASAP, super important. And then having the right staff, right? You want people that are aware and what to look for and know what the risks are so they can pay extra close attention, or, really have really, really extra, not intense conversations, but like important conversations, right? On being like, all right, I'm so glad that you came back, blah, blah, blah. It's really important. I really want to see you again. What works for you? And kind of working with you to do that, right? Because every patient is different. You can't tell the same thing to one patient as you do another. The overall goal is the same for everyone. You're trying to get everyone back to health, but the way that you go about it changes. And if you don't switch it, there's a chance that as a provider, you won't get through to them. And so it's also important to know that as patients to recognize that. And now we'll go ahead and jump to the next section about where we go from here.
Yeah, so in this section, I'm just going to kind of discuss things that the dental field could work on. And I'm going to start talking about things that providers could improve. So the first thing I'm going to talk about is like a lack of knowledge. I think dental training programs, they do a good job teaching kind of the biological process of HIV, but they don't always talk about what that translates into being when you're actually, treating and conversing with people living with HIV. I think they could do a better job of encouraging stigma reduction. Also, just from like my experiences so far and from reading different surveys at different dental schools or across providers, there's also kind of a misconception about putting on extra protection when the precautions that we take for every patient is sufficient to protect providers and other patients from transmission of HIV and a lot of other viral infections. So I think that's something that programs could do a better job of emphasizing, that sometimes those fears aren't warranted, and kind of just really understanding the reality. And then this statistic over here is interesting. So one survey found that 62% of dentists believe that they had a responsibility to treat people living with HIV. So that's, 38% of dentists who didn't think that they had a responsibility to treat those patients. And that's pretty significant when we've already established that patients have a right to receive healthcare that they need. And I also thought it was interesting that 68% of the dentist surveys would prefer to refer people living with HIV. And again, this is kind of talking about the lack of training that providers get, but also, their personal biases, and then also kind of just mentioning that, again, it's a right and basic care is necessary for everyone. There we go. And then so tangible things that the dental field in general could kind of talk about and work on. So we're going to discuss state Medicaid funding, medical and dental cooperation, and dental case managers. So there's already a lot of barriers to accessing care, from, like we've mentioned, lack of providers in rural areas, lack of insurance, whether that's eligibility or enrollment of those who are actually eligible, things like dental fear, and then again, stigma, like we've discussed. So I have two figures here that both come from a study that was done by the HIV Cost and Service Utilization Study. And some things that I want to focus here on this figure 2 on the left. This graph shows that shows a decrease in likelihood of seeing a dentist in the past 6 months, and some factors that could have played a role in that, or that the surveyors said had a role in that. And I wanted to point out that no dental insurance can cause a 1.5 times decrease in the likelihood of getting care. And then same with if somebody has Medicaid, but they're not enrolled in dental or they're not eligible for dental, it's twice as likely that they don't receive care. That's pretty significant. And it's definitely a place that we could work on. And then the graph on the right shows, this is just like a subset of, it's like people who actually wanted dental care. So an actual desire to get treated, because obviously some people, don't see the importance, whatever. But so with no dental insurance, it's in between 2 and 2.5 times more likely to not get the care for their perceived needs, so the care that they want. And then same with Medicaid without dental insurance, it's again over 2 times more likely to not get the care that they need. And again, that's pretty significant. And 20% of the surveyors who participated in this study reported that they had a need that wasn't met. So that's still 20%. That's a lot of people. I think a good model we could look at is Medicaid coverage for children. So the progress that states have made in increasing children's access to and use of dental care by providing stronger provider networks, leveraging accountability through contracts, and increasing in care coordination efforts provides a foundation for similar actions for adults in Medicaid. So this is kind of some things that we're going to talk about when I get to the medical and dental coordination part. But like at FITE, for example, on our 5th floor, when younger people come in to get medical care, we have dental providers up there who are working to make sure that they're also getting dental care. So this care coordination has really improved care for children, but I think it's like also a really good model to look at when we're talking about adults. And this is kind of along the same line. So state Medicaid programs focused on higher quality care with reduced costs often overlap with social support and services along with other healthcare. This newer model could improve dental care and increase access. So I think it's interesting that when we talk about like social support and services in combination with dental or medical healthcare, we can get higher quality care, but reduce costs. And like looking at it through this model, I think, is a positive light, like that there is a way to help a lot more people with this model. And so now I'm going to talk about that model a little bit more. So what do I mean when I talk about medical and dental cooperation? So from that same survey that I mentioned, they asked another question that was who had received care in the last 6 months. So 58% of respondents said that they had not, while 42% said that they had. So again, 58, that's more than half, like that's a pretty significant amount. And then, so what does it look like when we talk about seeing a regular dentist? So seeing the same dentist multiple times. So 65% of people who reported having a dentist that they saw multiple times had received regular care, while only 12% of those who reported not having a regular dentist had received care. So this really emphasizes that seeing a dentist multiple times, like having a dental home, is really important because it can make a huge difference in the likelihood of you returning for care. I think it's like important to talk about building a relationship with a provider. And a lot of times that's, like I mentioned before, that's done by when you're opening yourself up to advocate for yourself, to have those conversations. And then this was a really interesting stat as well. So 74% of the people interviewed who saw their regular dentist at a center treating people living with HIV had received regular care. So again, that's higher than those who even saw just any dentist. So it's kind of pointing out that it makes a difference whether or not it's at a center treating people living with HIV or not. So any increase is great. Like that's our goal here. So this could be a great place to continue working. And why do we see that increase? So I think a huge part of it is the ease of access. So if you have, to go to the medical doctor one day and the dentist another day, like it might involve you taking off multiple days of work, and it's more stressful. Like you have to figure out how you're going to get there, things like that. And so if it was kind of almost like a one-stop shop, like, you could do multiple appointments in one day because it's in the same area, that could be really helpful for a lot of people. For example, like, Philadelphia Fight's website, it has all the different branches that are part of Philadelphia Fight. So you could, you can access dental, you can access medical, or whatever other resource you need. There's also at different centers, patient navigators. So you could call, or when you go, and they can provide you like with a variety of resources that you're going to need or that you might want. And then something that's also beneficial for providers, especially, is shared medical and dental records. So you can ask patients, any updates in your medication, things like that, but you already kind of have a list of what medications the patients are taking. And like Dr. Mariche mentioned, it's important to kind of know those things as a provider. And then that also kind of eases the burden on a patient as well. Like you don't have to worry about like, I forgot to tell you that I do take this medication, or like, I don't remember the dosage. It's all there already. So it's kind of eliminates some stress. And then also centers that treat people living with HIV also can help eliminate perceived stigma. Just from different studies that I read online, or like Dr. Mariche mentioned, medical mistrust is very real. And like there is a fear of disclosing your health information or your health statuses with providers. And so if you're going to a place that like is very familiar with your situation, very understanding, and like is trained in how to have those conversations and help put people at ease, I think it can be really beneficial and just take away some of the worries of people looking for care. And then kind of to end here, I wanted to talk about dental case managers and their potential role in helping increase access. So what is a dental case manager? So they're supposed to be kind of modeled after a medical case manager. So somebody who helps patients schedule appointments, organize all of their healthcare needs, kind of they have many roles. And so the dental case manager, however, ends up being kind of more like a community health worker. So it's more like a frontline public health worker who is a trusted member of or has like an unusually close understanding of the community that they serve. This trusting relationships enables the community health worker to serve as a liaison, link, or intermediary between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivered. So that was a big paragraph, but some things to kind of take away here is like, it talks about cultural competence and it talks about being involved in the community and kind of using those connections to help other people get access to care. So just continuing on that, the role of dental case managers are for patient recruitment. If they're involved with the community, they're obviously going to have the ability to meet more people and to point them in the right direction. They're helpful for scheduling and transportation. Transportation can be a really big issue and getting to appointments reliably. So having somebody who kind of takes care of that can take some stress off of the patient. Visit explanation and accompaniment. Sometimes, especially if you haven't been to the dentist for a while, or if you are really scared, like having a dental case manager to go with you or to explain what's going to happen can be really helpful. Patient retention. We've already talked about this, like having a regular dentist or going to a center that treats people living with HIV for medical and dental is really important, but having like another key community player in that is really helpful to keep people coming back. Collaboration with HIV case managers. I'm going to go into that one in a little bit of detail on the next slide. And then patient education. So again, somebody who's more focused on the dental aspect of care can really talk about, why it's important, why you need to keep going back. Just kind of somebody to remind you, like, this is important. This is why you should do this. And they can help you advocate for yourself and like in these settings. So how has it helped? So there was a study done with focus groups in Cape Cod, and it was people who were using dental case managers for their care. And participants did notice an improvement in their overall health and their oral health. And I think this was interesting because this one also talked about mental health improving. But yeah, there was great success with those focus groups. And so I think that's really something to look forward to in the future. Like I mentioned before, it can enable HIV case managers to focus their effort. So case managers often have many patients and many services, so they have a lot going on. And so sometimes oral health isn't always prioritized, which, like, when you have a bunch going on, things get lost in shuffle in general. But having a dental case manager to work with the overall HIV case manager can really help make sure that oral health is still prioritized, still addressed, because as we have seen earlier, there is a huge need for that. Again, dental case managers can help with patient recruitment. They seem to facilitate access to dental care for those connected to medical care through community outreach and partnerships. So again, this is talking about like when dental and medical are working together, access to dental care can improve just because, there's people focused on dental care around those areas as well. And then patients also seem to improve. And in one study, of all of the respondents who had a dental case manager, almost all of them reported that having one helped them receive the care they need. I also really like that in that article is that a lot of the surveyors were kind of mentioning, like, hey, this could be really good for a lot of other groups. Like, and the elderly was mentioned in particular about like transportation and access to like actual offices. So I think that could be really cool. And I like that this model, this dental case manager, can really be applied to a variety of different groups that might be at higher risk for dental care needs. And then here are our references. And then I see